today it's going to be my turn to get adjusted. So this is just to let you guys know that everyone who has spine need an adjustment. Same applies to us chiropractor. So one thing about spine is that even though we know how to deal with a spinal issue, but we can't actually treat our own spine. So we actually need someone, like for me, it's my colleague, to help me with my spinal problem. So today, Dr. Carmen here will actually be helping me to adjust my spinal problem, and we will show you the process.
Knees wide open, close, open, close, open, close. So here I'm checking the motion of his pelvis. So open, close. I feel less motion on the left side. Okay, you can stand up for me. I'm going to pull down your pants slightly.
Okay.
So from here we can see actually the left side is slightly more narrow and the right side is wider, so his pelvis is actually rotated this way. And the left side is also lower, right side higher. Okay.
Oftentimes we have patients sending us images, X-ray or MRI, telling us that can you tell me where my problem is? It's important in this work that we let you guys know that we are not adjusting the X-ray per se. We are actually adjusting the patient. So we find the problem on the patient and not on the X-ray. Once we find the problem, this X-ray actually provides us with a blueprint of what and how to actually correct a particular problem. We don't just look at the X-ray and say, here it is, that's where the problem. That's not how it works. We check the problem because what we are dealing here is functional issue. We check the joint that gets stuck, that has mechanical pressure. When we find that, then only we refer to the blueprint and see how we actually correct it. If your spine has certain curve, that doesn't mean that it's unhealthy. A lot of things can actually cause a certain curve. Say short leg on one side, malformation of say your tailbone, your lumbar spine, hemivertebra, which is a malformation of the vertebra. All these can cause some curvature. So we actually have to check the person first before we know there are any particular problem in the spine. Okay? So we're going to do a push or a pull?
Push. Just relax. I'll roll you towards me and then I'll push towards this direction. Slightly a bit more. Open, close, open, close, open, close.
As you all can see here, we are not trying to crack or adjust all of the joint in our body here. We are just correcting those that are not functioning well. It's not more joints that being adjusted, the better it is for you. So we are only addressing those that need to be corrected. The rest that are healthy, we do not interfere with it. Alright?
Okay, we're done.
Okay, thank you. Hope you like it.